Hi, I'm Dr. Roadhouse, and I want to reintroduce Linda Bradshaw. We've already done a video of her when she first came in, maybe about a month into it, I think, wasn't it? So since then, she's had great improvement, and so why don't you it's your stuff. So why don't you tell us what's improved since the last video and from when you first came in?
When I first came in, my complaints, I just felt bad all over. I didn't have energy, I wasn't sleeping, acid reflux, the muscle aches and pains, and it just basically I had gone to several doctors and basically was either given pain pill or sleeping pill, which didn't work, and I didn't want to live like that. So
And what other medicines were you
well, I currently I still take my levothyroxine for
Okay.
my thyroid.
on? But you've been taking that
I've
for a
been
long
taking that for a long
time
time.
and no improvement.
No improvement.
Right, okay.
There was nothing. I still had, lethargic, just no energy. I was barely getting through work and come home, put something on the table for the kids and crash.
And you weren't able to lose weight.
Oh, never. I starved myself before I could lose weight. I mean,
Right.
there was no weight loss during that time. Couldn't.
So you're still taking Leo because your doctor still got
taking
you on
that.
that.
Got that.
And then we've done all the different treatments and the protocols and stuff. Talk first about sleep. How's your sleep doing?
Oh, the sleep's amazing. I was getting no sleep, maybe 3 or 4 hours, if that. I go to bed. I sleep, and that's amazing to
And how do you feel when you wake
I
up?
wake up refreshed. I know I
Okay.
slept.
Yeah. Okay.
So.
All right. And then what about the reflux? Because the reflux is really bad.
The reflux is really, really bad. I have not experienced any probably in the last 2 months. It's amazing. And it was already starting to decrease. And before that, I was taking Prilosec every day, which I started every other day, and now I'm not with the other supplements you have me on. I'm not even taking that at all now. I haven't taken that probably 3 weeks, I guess.
Okay.
But the Prilosec and done great.
Mm-hmm.
But it's also my diet, that I'm
Mhm.
eating better since being on this and knowing what to eat.
Right.
So having gone through this, so it's just made a difference overall in how I feel. My energy level. I come home now and the kids and I either we go to walk in the neighborhood to the park, we go to movies, we do things now. And weekends are very busy because I'm doing things. So.
And prior to this, you hadn't been able to
I didn't do
much
that.
at all.
I didn't do that. Weekends were still busy, but it was, I take care of my mother as well, but it was just pushing myself.
Mm-hmm.
I was just exhausted to the point that I actually have the energy to do that now. I feel, I'm actually living life now, not just going through surviving through the day.
Yeah.
So it's a big
You're actually thriving where you were surviving before.
Right.
Okay, and all the stomach stuff, that's...
Yeah, I don't have, I can say, the nausea is gone. And that was a 3-year, every day living with nausea. And just that mentally is just enduring, but I don't have that anymore.
Yeah. So, and the aches and pains, talk about that.
The aches and pains I don't have, I still have some tightness in my neck. I don't know if that's just the muscles. The aches and pains I was experiencing in my joints, even my elbows, gone.
Mm-hmm.
I don't have those. So it's just amazing. It's been life-changing, this whole journey coming here. I really had given up hope because I didn't think that there was anything we could do because I'd gone to so many doctors.
Yeah.
And you get told the same thing over and over. Well, can't help you if you don't want to take the pain pill. Here's an antidepressant.
Right, yeah.
So this has been life-changing. So I will continue on the supplements because they've just made a difference in my life. So.
Awesome.
Yeah.
Well, if you know anybody that's having a thyroid problem and they've been to the doctors, even if they're taking the medicine and they've been taking the medicine for years and it doesn't work, when we evaluate the patients, I told you, you had to have all the markers and parameters. If you weren't a candidate, I'd let you know. If you were a candidate and you did everything we did, you're going to get these kind of results. And you're doing fantastic. So if you know someone's given up hope, like Linda said, she'd given up hope. And she came into our office, we evaluated her, she's doing awesome. So congratulations on getting your life back and, and getting to do the things that you want to do. And I appreciate you as a patient and following everything because that's how you get better.
Right. Yeah, definitely, on the foods, you said this will cause this, it's gone. Don't want them. So, yeah, it's been amazing.
And what Linda's talking about is we do the testing to see which antibodies, and there are certain foods, and some patients have many foods. Basically, what happens when we do this test, and you produce antibodies. Those are like poison, and they can cause brain and colon inflammation for 30 days, and they can just inflame you from head to toe. So after we did the test, you knew, best test in the world, and you knew exactly what. So it helped give you more commitment, I think, to go, this test says this. So you were able to, follow our directions and do real good, and you've just done tremendous. So, all right, thanks a lot.